Okay guys, let's start talking about cases. Today we will talk about trauma cases. I think it will be interesting for you because there we will talk not only about trauma, but we talk about rentgenology, radiology, X-ray, and it will be interesting for you, for my opinion. Okay, first case. A pedestrian is hit by a car with a sliding impact. Hit his head on the car. The state of moderate severity. There is a general inhibition with preserved consciousness and orientation. Facial hyperemia, localized headache in the area of impact. The patient is lying on his side on the site of the impact. There is bradycardia, increased blood pressure, rapid fatigue, and decreased muscle strength, as well as a difference in the reaction of the pupils to light. What is your diagnosis and actions? Write on the copybook now. What do you think about this case? You can pause this video. Case number 2. During sports competition, the participant received a strong blow to the left half of the chest. After he has pain in the place of impact, sharp shortness of breath, which increase quite quickly. The general condition of the patient is deteriorating. From the site of the injury, the breath is not listened to. Percussion tympanitis. What is your diagnosis and actions? Write to your copybook the second case answers. What you think it is and what we need to do. Third case. As a result of the car accident, the passenger received a strong chest impact on the dashboard of the car and on the suitcase, diplomat, lying on his lap. Diplomat, it is some kind of bag. The state of moderate severity. Marks pain in the area of impact. Pale, not increasing weakness, dizziness, thirst. Thirst, it's like he won't drink water. Objectively, paleness of the skin, tachycardia, weak pulse, a decrease in blood pressure to 100 delayed 60, coughing with blood clots, percussion, bluntness of sound in the lower chest. Uh, what is your diagnosis and actions? Write to your copybook. Answer to case number 3. Stop the pause or what you want to do. Next case. Case number 4. A patient came to the clinic complaining of pain in the right shoulder joint. The pain appeared after playing badminton. When examined, the first position of the right upper limb, the head of the humerus is absent in its usual place and is determined in the axillary area. With passive movements, there is a restriction of mobility of the limb, accompanied by pain. What is your diagnosis? What research method will help verify the diagnosis? Write to copybook. Answer to case number 4. Case number 5. The patient was admitted to the emergency room with complaints of pain in the right shoulder joint. During the examination, a diagnosis of dislocation of the right shoulder was made. The dislocation was corrected using the Genelidze method. I think you don't know what is Genelidze method, but it is a method of correction of dislocation of. It is a method of correct dislocation of joint. use they corrected, plaster cast was applied, and the patient was allowed to go home. What mistake was made in the treatment of the patient? Write this answer to case number 5 to your copybook. And case number 6. A 54-year-old man was taken to the emergency room in a serious condition. It is known that he was in a car crash accident, and an hour ago. On examination, the intercostal spaces are smoothed, and the left half of the chest lags behind when breathing. Over the left pulmonary field tympanitis with auscultation. Breathing on the left is not hearing. The breathing rate is 30 per 1 minute. What is your diagnosis? How can you confirm it? What is the amount of manipulation? No, what is your diagnosis? How you can confirm it? And what you will do with this patient? Write it to your copybook. Now you have 6 cases, and I want and you write it in copybooks. Case number 1. What I want your answers in the comments. Yes, there. Want 6 cases. For example, case number 1. It is a peritonitis. Case number 2. It is a appendicitis. Case number 3. It is a cholecystitis. Case number 4. It is a and else. And what you need to do. Yes, how you write it in copybook, please write it in comments downstairs of video. For me, it's interesting to understand how you understand it now and what you don't understand. Now please do a pause of this video, and I go to answers of this video. And please write your answers. I want to see 30 comments downstairs of video. 30 comments. Please guys, I pleased you very much. Okay. Answer to case number 1. Diagnosis: compression of the brain with a hematoma. Tactics: immediate hospitalization in the neurosurgical department, X-ray of the skull, echoencephalography, CT. What do you want? If the brain structures are displaced, we need to do the trepanation. In the picture, you see a trepanation operation of skull surgeon. We need to open the skull. We need to take away hematoma, and then we need to suture it. The hematoma is removed and the bleeding is stopped. Decongestant therapy, sedatives, antihistamines, painkillers, and vasodilators. Locally called to the head. Okay, it's answer to case number 1. If your answer is like this answer, you are right. If you have mistake on this answer, it's not necessary. Remember that only mistake take you to grow up. Okay? Don't shine to mistake. It's normal. Okay, case number 2. Answer. Diagnosis: a rib fracture, complicated by valvular pneumothorax. You need to know what is valvular pneumothorax. I will explain you in the next picture. It is necessary to immediately transfer the closed strained pneumothorax to the open one and urgently hospitalize the patient. There in X-ray you see pneumothorax. Yes, pneumothorax. It is a lung. it is a lung, and it is a normal lung. You see a vessels, yes, vessels. This is vessels. This is not a bronchus, it is vessels. Okay, and there you don't see vessels, no vessels, only air, only air. This all is air. And of course, when we talk about valvular pneumothorax, we need to understand that air in pneumo in thorax, in this side of thorax, we need to understand that air will be bigger and bigger, more and more air, and this air will dislocate all organs to the normal side, and it is very bad. How we can help to our patient? We can do a punction, yes, with drainage of air. But of course, we need in the hospital, after clarifying the diagnosis, it's necessary to drain the pleural cavity with active aspiration and monitoring. If necessary, perform suturing of the damaged lung and bronchus. And now I want to talk with you about valvular pneumothorax. You need to understand that when we breathe in and when we breathe in air, you see this is a lung, and air with valvular pneumothorax will come in to our thorax, to our damaged side of thorax, and there you see that we have air, yes, and somebody there, we have a valve what will open when you breathing in, it will be opened, and air go to the pleura, and when you breathe out, this valve will closed, and air can go away, it can go away, and it means that pressure of air there in this side will be bigger and bigger, pressure will grow up, and it is very bad because pressure there will dislocate organs in normal size side. Okay, it is a valvular pneumothorax. Often when we talk about pneumothorax, you need to know about open pneumothorax, closed pneumothorax, and valvular pneumothorax. If you know about these three pneumothorax, it's very good. If you don't know, and if you want a video about this, I can do it, or you can read about this on the books. Okay, case number 3. Diagnosis: rupture of the lung with internal bleeding. Immediate hospitalization is required in a position on the patient side with the head and lowered. Yes, this position of Trendelenburg with down of head for 45 grados. Okay, immediate hospitalization in the hospital, X-ray monitoring, pleural punction. If the symptoms of bleeding increase, immediate surgery, stopping bleeding, hemostatic drugs, and fighting acute anemia are indicated. Look there, you see X-ray, yes, you see a gammothorax, yes, it is a gammothorax, and of course we need to do a drainage. We do a drainage, and we need to do a probe of Gregory reservoir method to checking the blood bleeding is stopping or it is continuous. You remember that we need take some blood, we need take some blood and blood, liquid, and if it go to a thrombic, to clot of blood, yes, clot, it is positive probe of continuous bleeding. It means that bleeding is not stopping, it is continuous, and we need to do operation. Then, if we see that liquid blood don't go to clot and it is liquid, it is a negative probe, method, negative checking, and it means that bleeding is stopping. Okay, and we don't need to do operation, and we stay at drainage to drainage all blood out of thorax. Case number 4. The patient has a clinical picture of dislocation of the right shoulder. To confirm or deny the diagnosis, radiography of the right shoulder joint is necessary. Yes, you see that our patient's shoulder go away from joint. It need be there in normal situation and it is lower. Okay, it is a dislocation of joint. Remember that we need always do X-ray for these patients. And case number 5. You remember that there you need to find mistake. What don't do doctors? Despite the clinical picture of the dislocation, to exclude a concomitant fracture, it is necessary to confirm the diagnosis radiologically. After the reduction, it is also necessary to perform a control radiography. So mistake of this situation that they don't do X-ray at first row, yes, before they do a correction of dislocation. At first they need to do X-ray, yes, then they do a correctly of dislocation, then they do X-ray to controlling yourself. It's a normal dislocation or not. Correction, X-ray. To X-ray when you talk about dislocation. Okay, and case number 6. The patient has a clinical picture of left side closed traumatic pneumothorax due to lung rupture. The diagnosis must be confirmed by X-ray examination. We need to do puncture and drainage of the left pleural cavity in an emergency order. There you see X-ray, and there you see that lung is collapsed, yes, and you see a pneumothorax there, because you don't see any vessels, yes. Okay, and density of this lung is like this lung. Great. And there you see drainage, yes, to help these people with pneumothorax. And we stay in this drainage before all air don't go away. And you need to remember that when we talk about drainage of air, it drainage need coming to upper. And when we talk about all liquid, yes, hemothoraxes or liquid thoraxes, we need to understand that all liquid will be in downstairs of thorax, and we need to do a drainage there, like this one. Okay, that's all what I want to tell you. Thank you very much for your attention, And of course, if you have any questions, and if you see that your answers is not right, yes, yeah, and you have some mistakes, maybe it is necessary to read about this one, or we can talk about this one in the lessons or in the online online token. Yes, I'm always open for you. Thank you very much. Bye bye.